Thank you. I'm delighted to be here to share Canadian perspectives on palliative care standards. As we go through the data, I'd like you to remember Jim and his family, because these are views of real people and real Canadians and their experiences and the impact of those experiences. Their expectations that they have for palliative care, for them and for their loved ones. I also wanted to just make sure that we also acknowledge the Canadian Partnership Against Cancer and Covenant Health to fund this public opinion research. We first conducted a series of exploratory focus groups, and yes, they are extremely interesting to conduct because they provide a great deal of context to inform quantitative measures. We did a focus group in Montreal, one in Toronto, and one in Edmonton. The one in Edmonton was exclusively with the Indigenous community. And we presented them with the 6 questions that you will be discussing here today. And their responses then helped us inform the development of the survey, which followed. We did the survey online. It was with over 1,500 Canadians aged 18 years and older. It was conducted at the beginning of August, and the associated margin of error with results among over 1,500 Canadians is plus or minus 2.5%. Okay, so solid, valid results. To paint kind of the context in which this conference actually exists is the issues agenda here in Canada. Okay? Tomorrow it'll be all about the US election. But traditionally in Canada, it's been about healthcare and the economy. This year we've seen a little bit of a jump in the issues agenda pointing to the economy because of some of the economic downturns that Canadians have experienced. I too am from Alberta, and we see economic issues on the issues agenda a little bit higher out there, as well as in Atlantic Canada. Historically, as you can see, economic issues and healthcare have been a priority for Canadians. Okay? This has been consistent over the past several years, and it's a concern for Canadians. So the conversations that we're having here today are important. Healthcare is important to citizens of this country. So how much do they really know about palliative care, and where are they learning about it from? In the focus groups, we asked them, well, what's the difference between palliative care and hospice care? And some of the contextual information that we got was that palliative care was a little bit more, a little bit less sensitive and took place in a hospital facility. And hospices were viewed as a bit more compassionate and accommodating. Okay? Overall, participants are really not all that sure of what the differences technically are. In the survey research, we measured awareness of palliative care. En français, c'est soins palliatifs.
In French, palliative care.
We found that 58% of Canadians are aware. But if we look at the intensity levels of awareness, only 16% say they fully understand what palliative care entails. That's not a great deal of Canadians. When we look at the term residential hospice care, 49% are aware, but only 10% are fully aware of what that means. End-of-life care, 55%, with 13% being fully aware of what that means. And with advanced care planning, 36% say that they're aware, with only 8% really knowing what an advanced care plan involves. We also further measured in the survey how many Canadians actually had a written advanced care plan for themselves, and just 11% have one currently in place. Canadians are getting their information through word of mouth. The medical community and the government does not own the content of the message and the information that's being shared. What that means is that it could be incorrect. So there is an opportunity to educate the public about what palliative care entails. We also looked at some experiences that Canadians had with palliative care. In order to make sure that everybody had the same reference point, they were provided with a definition of palliative care as defined by the reference working group. We found that 1/2 of Canadians had known someone important to them who's received palliative care within the past 10 years, mainly in a hospital facility setting, but also in a long-term facility at home or in a hospice. Among those who had known someone who had experienced palliative care, 89% said they were satisfied with the care received. Again, I want you to look at the intensity level, though. 37% say that they were very satisfied, okay? And 52% said somewhat satisfied. So remember that that does represent opportunity for improvement. I mean, if somebody asked me, Erin, could you rate satisfaction with your marriage using this same scale? And I said, well, I'm somewhat satisfied. There is room for improvement, okay? When we look at reasons for satisfaction, we see that it's overall general good care, but that sense of comfort, which is a word that I've heard several times already this morning, and compassion, which is another word that I've heard several times this morning, are important elements of why people are satisfied with palliative care received. On the other hand, general poor service, being understaffed and under-resourced, the helpfulness of staff, and long waits and lack of funds are reasons for dissatisfaction with experiences received. One of the verbatims that I liked about why people are satisfied is that from the mouth of my late relative, if I had known I would be treated this nice, I would have started dying sooner. Okay? These quotes will be up on screens throughout the duration of the conference, as well as quotes that were taken from the focus group research that we conducted prior to the survey. We also noticed in the focus groups that there seemed to be a bit of dissension with satisfaction levels depending on the location in which the palliative care was received. Here we found that 93% were satisfied if the palliative care took place in a hospice, 86% if the palliative care took place at home, 85% if the palliative care took place in a hospital facility, and 82% in a long-term care facility. So there are some differences depending on the type of location where the palliative care was received. We also measured the extent to which Canadians will be expecting to provide palliative care within the upcoming year. 7% were pretty sure that they were going to have to do that, and another 24% said maybe, okay, weren't quite sure. We also provided respondents during the online survey with another definition point, and that was with respect to advanced care planning. Have they had conversations about it? 43% say yes, they have. Okay. The specific individuals that they're talking to about it remains largely with family and friends. And we also know that only 11% currently have a written advanced care plan. So conversations are starting, but not necessarily turning into implementation of a document. So getting on to what Canadians expect. During the focus groups, and with the expertise of the reference working group, there were a list of 27 possible elements of a palliative care program that we presented to Canadians to get their views on whether or not, or the extent to which they agree or disagree that it should be an essential element of a palliative care program. These elements were randomized, so they were presented in different orders all the time to avoid any response bias. And what we saw was a range of 64% agreement up to a high of 92% agreement. Okay, we'll go through these in detail so that you can see the intensity levels of agreement. But in general, we have pain management, personal hygiene, nursing care, medications, meals, physician and doctor care, specialized in palliative care, someone in the system to help coordinate all of the different healthcare services required, having support workers, dedicated palliative care unit in healthcare facilities, psychological counseling, nutrition management, minimum nurse to patient ratios was also brought up, social workers to explain services, beds for families to stay overnight, services on request, volunteers, frequent monitoring of patients, access to television, pharmacists, dietitians, physiotherapists, and communications devices for families and loved ones to check in on the status of their loved one while they're away. Access to Wi-Fi and music therapy being a little lower, translation services, and clergy faith leaders being a little lower, and pet therapy down at the bottom of the list, okay? What's important here, though, is that expectations are pretty high. The majority of Canadians agree that all of these things should be part of a palliative care program. The extent to which they agree with each of these elements is in the report documentation that you can look at in detail online at palliativecarematters.ca. So here we see on the right-hand side that the intensity levels of agreement are quite strong. These are elements that Canadians feel very strongly about including in a possible palliative care program. You'll see the intensity levels then go down a little bit for this next set of potential elements. However, overall agreement is still over 80% for each of these items. Okay. Intensity levels go down again a little bit more for the next set of potential elements for a palliative care program. And then lastly, we have much lower intensity levels for this last series, which could potentially be more nice-to-haves than must-haves. We also measured some attitudes towards palliative care. So what's important to Canadians is that they have access to visit their loved one at any time. 91% would like that. They also would like the public health system to cover the cost of palliative care, 89%. 85% feel that the environment and furniture should provide a home-like setting. And 76% say that patients should have the ability to practice cultural traditions. Interestingly enough, I thought this might be a little different with our Indigenous respondents, and it wasn't. There were no meaningful statistical differences, because in the focus groups with the homogeneous and Indigenous focus groups we did, they actually expressed a desire to have some of their cultural traditions in palliative care. Some of their elders' lodges are at capacity and can't provide the required care for elders at the end of life, so they have to go into the city and they can't smudge in their healthcare facility or have neck bones to eat or attend a sweat or a drumming ceremony. So I was surprised to see that these numbers weren't vastly different. We also looked at 13 additional elements that would apply to a possible palliative home care program. And there's two slides here. Expectations are high. Canadians really feel that all of these elements should be part of a palliative home care program. And that begins with 24/7 access to nurse specialized in palliative care. 91% agree with daily assistance with caregiving. These would be things such as bathing, lifting, administering medications. 91% agree that access to equipment should be available. And the same proportion say that panic alerts should be available to patients when left alone. 91% say education and information is required for caregivers themselves. 91% again say someone in the system is needed to coordinate all of the various aspects of care that are required. And 90% say that they need a single access point for help when needed. The other elements for home care, they want on-call access to a doctor specialized in palliative care as well. 87% want respite services, 86% want social workers, 85% want an in-home chart available for people to check in on the status of the patient. 83% want financial support for caregivers who have to take time off work. And 80% want renovation funding. Okay? And again, pay attention to those intensity levels of agreement in your discussions. So there is support for palliative home care. Patients should have the right to receive care in their home at the end of life. 58% strongly agree with this, 90% overall. The public health system should cover the costs of palliative home care. 54% again in strong agreement, 86% overall. Access to all types of palliative home care services should be available, 86% agree. Palliative care should be provided in a person's home as much as possible, 86% agree. And when we look at rural and urban struggles, palliative home care services should be provided as frequently in rural locations as in urban centers. So they see this as universal in nature. On the caregiving front, there are information needs, and we also checked in on some of the confidence levels of caregivers actually providing palliative care. They have a plethora of information needs, and as we saw, they don't really know a lot about palliative care until coming face-to-face with it. And so they need to know who to call, they need to get training on how to use equipment, they need to know what to do when the patient dies at home, training on giving medication, among a whole list of others. So education is really desired by those who are caregiving. They think that the system itself and the medical community should be providing this training. That's where they would like to get it from, because the medical community, of course, are the experts in providing palliative care. They would prefer to get their training and education in person. And they feel strongly that they should have access to such training from the medical community. They also feel that healthcare providers working with the patient themselves should ask the caregiver if they need additional information or training and get a little bit more involved in bridging any gaps that may exist. They also agree that healthcare providers working with the patient should ask the caregiver if they need any help or respite. Everyone needs a break. Healthcare providers working with the patient should be asking if the caregiver feels comfortable in their role. And healthcare providers should be quietly observing the caregiver's work, noting any areas perhaps of training that they could offer if, again, there are gaps. And as you can see, the scores here are quite strong for that. So they would like this as an element of a palliative care program to provide information and training. We found that 1/4 of Canadians have provided services as a caregiver to someone important to them. In fact, 4% of them were currently providing that care. Among that 1/4 of Canadians who've been caregivers, only 1/4 felt very confident in their role. So again, there is a need for education and training to make sure that we can improve confidence levels with caregivers. They mentioned that in a previous slide, it was mentioned that financial support was another element of palliative care for caregivers taking time off work. Only 15% of Canadians are actually aware of compassionate care benefits, okay? And even with that, they're not fully aware of what the program entails. Canadians were also asked about their perspectives on what training activities and background palliative healthcare providers should have. And here we get quite a sizable majority saying that healthcare providers working in palliative care should have proof of additional palliative care certification, okay? There should be supervisors conducting regular spot checks. 86% agree with this. Surveys should be conducted among family members during and after palliative care to check in on measurements. 84% agree. 82% also agree that surveys should be conducted among caregivers during and after palliative care. 79% agree that surveys should be conducted among patients while they are receiving palliative care. And 79% agree that mandatory annual training should be required of palliative healthcare providers. And finally, 71% agree that family members and caregivers should be educated by case managers or social workers as to the questions to ask palliative healthcare providers to ensure that they're qualified. Okay? So they definitely do want an element of specialty practice area for palliative healthcare providers. Okay? For qualifications, they want a certain amount of experience in palliative care, 89% agree. 86% want additional training with that specialization, with that certification. 85% want psychological screening for compassion and empathy, and we heard this in our focus groups as well. 82% want mandatory annual training for palliative healthcare providers. A couple of other questions that pertain or will pertain to your discussions over the next couple of days include expectations of the federal government. 86% expect the federal government to develop and implement national standards for palliative care in Canada. There is strong support for this initiative, and that includes 47% who strongly agree. What about integrating national standards into the Canada Health Act? 85% would support this moving forward, including an even stronger proportion, 53%, who strongly agree with this. Canadians would expect transparency. They would expect to have access, readily accessible document about what the palliative care program would look like. And maybe not all of them would read it, but they want to know that it's there. And 70%, however, are concerned about the additional costs associated with implementing national standards across Canada. And we heard this in our focus groups. So if this proceeds, how much more is it going to cost us as Canadians? Okay? We saw that the National Issues Agenda had economics right up there at the top. Issues related to the economy. So fiscal prudence is on the minds of Canadians right now as well. I know that you'll be discussing public health campaigns as well during your time here at the conference. And we asked a few questions about public health campaigns in the survey itself. 91% would support the development of information materials that could be then leveraged and distributed right through the healthcare system itself. 89% agree that we need to ensure that palliative care information is available on federal and provincial government websites. 85% agree that we should conduct public awareness campaigns to inform Canadians about palliative health care services and standards. 80% agree that we should conduct satisfaction surveys with families after the death of the person, and 72% agree that we should conduct annual surveys to measure and track Canadians' awareness levels of palliative care. With respect to public health campaigns, Canadians were given 4 choices. Which one of these best reflect their views regarding a potential public health campaign regarding palliative care standards in Canada? At the bottom, only 6% say the government should not undertake a public health campaign for this initiative. Back to the top, 42% say yes, they should definitely do this, definitely. An additional 41% say support a public health campaign if it entails reasonable costs. Again, fiscal prudence comes into play. Okay? And 11% say any public health campaign should be very moderate in scope. With the data, we can also look at the effectiveness of the various communications channels, traditional media, of course, being fairly prominent for this particular initiative. It does vary, however, depending on various subgroups, and that detail is available in the report. In the interest of time, this is in the presentation as well that will be up online. There are some differences in subgroups of the Canadian population which are interesting to explore, and that can provide opportunities for niche educational strategies and looking at the various needs and preferences, not only across the nation, but within gender and age and income levels. So 6 slides are left, one for each of the questions that you will be discussing over the course of the next couple of days. Question 1, what are the essential elements of an integrated and coordinated palliative care program that will help to improve access to quality palliative care in Canada? All right. We saw the results of what those essential elements should be, according to Canadians. Expectations are very high. The majority deem all elements as essential. They also have a healthy appetite for higher quality healthcare services. Healthcare has been at the top of our issues agenda for a number of years. And satisfaction with palliative care appears to be quite positive. We saw it at 89% overall. However, we looked at satisfaction among those currently providing palliative care, and we saw lower scores. So we found that interesting that we're not sure if that indicates a trend or just a lower point in a person's time. So these are some elements to take into consideration for discussions regarding question 1. With question 2, do public health campaigns effectively improve the awareness and quality of palliative care? Well, first of all, we found that awareness of palliative care is not widespread, right? 58% overall, but only 16% fully aware. So educational opportunities exist. Canadians primarily receive information about palliative care via word of mouth, and so again, the medical community and the government does not own the content of the education that is being shared. It could be correct, but it may be incorrect as well. The data suggests that solid support for a modest campaign exists and that the healthcare system should be leveraged as a channel through which to distribute information materials. Pre- and post-campaign measures are required to properly answer part of that question. And so you have a benchmark now, and you can go back and take a look at that over time. With question 3, what are the essential components of quality palliative home care? We saw how agreement fell out with those levels, and we saw that expectations, again, were very high. We also saw that 90% agree that patients should have the right to receive care in their home at the end of life. We saw that 86% agree that access to all types of palliative home care should be available in rural regions, so truly universal. And 86% agree that public health system should cover the costs of palliative home care. Canadians definitely see value in a palliative home care program, but one of the questions remains and was brought up in the focus groups is the integration of all of the desired elements logistically and financially feasible in all rural and urban centres. Question 4, what resources are required to ensure adequate education, training, and mentorship for all healthcare providers and caregivers of Canadians experiencing a life-limiting illness and their families? We see here that confidence levels in palliative caregiving are moderate, and there's definite room for improvement. They'd prefer to be trained in person by those within the healthcare system itself. And Canadians see palliative health care as a specialty practice. They want experience and specialized certifications for the healthcare providers. And they also want that psychological screening for empathy and compassion. For question 5, what have strategic frameworks and plans accomplished for palliative care when adopted? The survey research can only provide certain insights into strategic frameworks for your discussions today. I know that there are many experts in this room that will be bringing additional expertise, information, statistics, and a wealth of information for your discussions. The context that the survey results can provide for this particular question is that Canadians express robust support for the development and implementation of national palliative care standards. However, in an era of economic downturn, financial concerns are also prevalent and need to be taken into consideration. Canadians would expect a plan to be readily accessible in full transparency to them. Some may want to consider trade-offs for the use of taxpayer dollars invested, and that may lead to the question of whether or not the public is consulted on recommendations going forward for the initiative. Lastly, with your question 6, does measurement of indicators that address desired outcomes, including patient-family reported outcomes and experience, improve the quality of and access to palliative care? The survey research, again, can only provide certain however, so the opportunities for improvement, even in this survey alone, we found reasons for satisfaction and dissatisfaction, and we can actually identify opportunities for improvement. You can go back in then and measure overall satisfaction to see if the quality of palliative care has improved over time. And we note that although not the purpose of this survey, the data reveals possible improvements to palliative health care, providing for training, for funding for additional resources, upgraded accommodations, improved communications, among a few others in the data received. I know that we don't have a lot of time, perhaps for questions if we're trying to make up time, but I, of course, am happy to provide any further detail on any of these measures during the break or over the lunch hour as well. So as other information, I mean, this is just one input into your discussions today, but as part of that, remember that Canadians' views matter. Jim's story matters. And so these measures are important to take into deliberations, but you will be receiving a wealth of additional information from the experts here in the room today as well. So I wish you all the very best with your deliberations as the conference continues. Any particular questions, or are we doing on time?